One of the most common types of learners that we often experience in the emergency department is the novice learner. Whether this learner is still a student, an early resident, an APP, or part of the support staff, it is our duty as educators to know how to properly teach these early learners. So during this session, we plan to define who the novice learner is, talk about some of the baseline skills that they will be coming in with and some of their goals. We'll be covering 4 different teaching techniques to use with novice learners, including 2-minute observation, Ant Mini, spit, and activated demonstrations. We'll then have some time to discuss and reflect on some of the applications of the techniques that we cover today. So who is the novice learner? First off, this is not based on the level of training of the learner we're talking about, and it's not based just on the time that they've been in training. It's really defined based on their skill, their experience, and the background that they bring to the teaching experience. As a reminder, the novice learner is going to be someone who's in the reporter or interpreter sections of the rhyme mnemonic. And this is really somebody who's kind of still figuring out how to take information and develop it. And we'll talk a little bit more about what these level learners can do on the next slide. So the novice learner is able to ask the right questions to collect data from patients most of the time. They will be able to develop preliminary sets of differential diagnoses based on the data that's been collected. And they should be able to prioritize a list of most likely to least likely diagnoses for a patient based on their information that they obtain. The novice learner will have their goals, and these will include to apply their knowledge that they gain from the classroom or textbook to a clinical scenario. They're looking to learn practical knowledge from experts in the field, such as you, and build pattern recognition and an inventory of the experiences that they're obtaining during their clinical time. So these are the 4 teaching techniques we're going to be covering today and that can be used with novice learners. The first of these is the 2-minute observation. So the goal of this is to have the clinician observe the student-patient interaction for just 2 minutes and slip out of the room sort of during this time period. It should usually be the first 2 minutes of this patient interaction so you can observe the way the learner takes the history. The educator would be sure to explain the process to the learner ahead of time and the patient to avoid any disruptions or make them kind of confused by the interaction. In a private setting, following the observation, you plan to debrief with the learner, going through things such as asking them their own reflection of how the encounter went, and then being able to give feedback, utilizing the self-reflection that they gave to you sort of as a guide. The next teaching tool is something called Ant Mini. This is a technique used to build pattern recognition with a learner. It's a great tool to use with a junior learner when the day might otherwise be pretty routine and when there's kind of the typical basic complaints. It's really important to explain to the learner ahead of time what you'll do and make sure that the patient is also aware that you'll be using this technique. So presentations for this are based on more bread and butter classic cases, and rare complex cases are not typically appropriate for use of this technique. This technique is based on the idea that you can easily recognize your Aunt Minnie, if you have an Aunt Minnie, from a mile away based on her unique characteristics, based on how she dressed or the sound of her voice, how she walks, etc., even if you can't see her face. So in medicine, we do this often, and you've heard this in the phrase, if you hear hooves, think horses, not zebras. So the learner will see the patient, present the chief complaint and their presumed diagnosis. And while they're kind of writing their note or documentation, then you would go see the patient and consider their presumed diagnosis. After you see the patient, you would come out and discuss their differential with the learner and why it is that they came to their presumed diagnosis. And then you would kind of probe a little bit further about kind of their clinical reasoning and give some feedback on your interpretation of the data that you obtained as well. The next skill we're going to talk through is called SPIT, and this SPIT mnemonic stands for serious, probable, interesting, and treatable. Sometimes the learner will struggle with ways to think and create a broad differential diagnosis in the emergency department. And this mnemonic can really allow them a way to expand some of the things that they're already thinking. This is especially good for learners who you notice tend to give you a very narrow differential. And so when they present the case, you would ask them to give 1 to 2 diagnoses for each thing within each of these categories. So give me 1 to 2 things that would be serious, probable, interesting, or treatable based on the information that you obtain from the patient. You can further expand this by asking the learner about the history, exam, or diagnostic findings that made them kind of think through these or would make them the diagnosis more likely. Finally, let's discuss activated demonstrations. This is basically a type of apprenticeship model. In this technique, the educator frames the interaction by introducing the skill that's going to be observed. This can sometimes be as simple as a clinical skill, such as taking a history or performing an exam maneuver, or even, something more complex like placing a central line or leading a code. And the learner observes the educator perform this skill. Following this, the educator facilitates the reflection of the learner and sets some follow-up goals for next steps with the learner. So what are their future goals based on what they observed? The benefit of this type of apprenticeship model is that the learner can learn a skill directly from an expert, especially during times when the emergency department can be very busy, which I'm sure we've all experienced. The final part of the reflection, though, is really key. And this is the part where the learner really gets to imagine themselves trying to carry out a similar skill in the future. And so really be sure that you create even just a 30-second time frame to go through that reflection with your learners. All right. In conclusion, when working with a novice learner, be sure to help them ask the right questions, develop preliminary lists of differential diagnoses, and we provided some structure on how to do that. Figure out how they can prioritize that list. We've helped you understand the goals of the novice learner, including applying some of their basic knowledge that they have from the classroom, learning practical skills that will help them in the future, and build pattern recognition. And a reminder that there's several techniques you can use for these types of learner, including 2-minute observation, and mini, spit, and activated demonstrations. It's now time for our post-curriculum activity. Please use the activity printout accompanying this module to assist with the exercise questions. So please pair up after you think for a moment about this question. In the pair, you can discuss your answer. Of the skills we reviewed, can you think of an opportunity you may have had on your past few shifts to use one of these? 2-minute observation, Ant Mini, spit, or activated demonstrations. When you're ready, pair up with your neighbor and share how you could have used one of these.